Welcome to The Better Life with Dr. Mary Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mary Ann Pinkston.
Hi, everybody. I'm Dr. Mary Ann Pinkston, and this is The Better Life with Dr. Pinkston, a podcast brought to you to help you understand some more topics in medicine that I hope are a little bit more in depth than kind of going to your contemporary doctor. Many people find that when they go to their doc, they don't get the answers that they're looking for, and it's such a shame. These days, things have changed. I am an old-fashioned doctor of 25 years. I still own a solo private practice. I do it the old-fashioned way. And I love being an advocate for patients who are looking for true and real information. So today, normally I have somebody that I record with and a guest on, but today I'm going to be alone at the mic, and I want to talk to you a little bit about a topic I find extremely important that is overlooked widely. This is not just an integrative topic. This is actually a contemporary medicine topic. Again, overlooked widely by most physicians. And so I think the underlying issue is something that is extremely pervasive to a high cost of our medical dollars in the United States. And if identified and treated, would significantly help reduce the cost, but also help people with longevity and live longer, not just longer, but a better quality of life, a healthier life. You can be around for your kids, be around to work longer, do your passion longer, whatever it is. Now, the problem is, though, it is marred by a lot of myth. And if people, I think, avoid talking to me about this topic more than any other topic that I discuss with patients. And that is obstructive sleep apnea, or OSA, or just sleep apnea. Okay, when I say sleep apnea, I know what comes to your mind. There is a vision of being in bed, with your significant other and this massive machine over your face, a loud noise generated from the side of the bed preventing you from sleep. And this is absolutely not what this is all about. I will tell you a quick story. I had a gentleman who used to see me. This was probably 15 years ago. And he always complained about being extremely fatigued. So we talked about the usual suspects, testosterone, stress, lack of sleep, things like that. And upon, further questioning, I did reveal several factors that I think you need to look at. If you have these symptoms, then you could most likely have obstructive sleep apnea. I've got a little few notes here. But the problem was that when I discussed obstructive sleep apnea, he got the same vision in his mind. A giant machine, his spouse not being able to sleep, he not being able to sleep. And, the aesthetics of that is not real sexy. I get it. So I know he visualized that. But his symptoms were excessive snoring. So his spouse couldn't be in the same bed with him anyway. He would, it wasn't every night, but it was most nights. And some patients can rattle the upstairs. Some patients can just snore lightly. Most patients will also hold their breath. So you'll notice somebody's asleep and then all of a sudden are quiet for a short period of time and then suddenly gasp and take in a deep breath after a few minutes. And sometimes it can be a few minutes. It's quite frightening. I know patients have come to me and said, I think my husband's going to die in the middle of the night. I'm frightened. And believe me, this is something that you will not die immediately from. You will not choke and die in the middle of the night from holding your breath. Your brain automatically overcomes and overrides that issue. So it will make you breathe. But what happens is the constant holding your breath reduces the amount of oxygen that stays in your bloodstream. We need a certain amount in the bloodstream to the red blood cells at all times to feed the little tiny arteries and capillaries in the body and all the tissues and cells of the body. We need oxygen to move very, very quickly and easily and in a copious amount. So when you have these little times of pauses, and they can happen hundreds of times a night, they can happen 20 times a night, these little pauses, your oxygen will drop, and therefore the oxygen levels will not get to all of those cells and tissues. And your tissues start to starve. It starts to send little signals that request, hello, I'm needing oxygen here. And those little signals become very, very important over time, which I'll explain in a few minutes. But what happens is most men then or women, this happens both, men and women, keep in mind it's both. But what happens is you can feel excessive fatigue throughout the day. You wake up in the morning, you really don't feel like you've had a refreshing sleep, neither does your partner. And then you can get into traffic, or you can sit in bed or at a desk and read, and study. You can be in class and fall asleep. So all these areas where you take a few minutes to kind of relax and your brain takes your active brain takes a little bit of a back seat, you'll start to feel sleepy. Your eyes will literally close and you can fall asleep at a traffic light. It's very dangerous. Let your foot off the gas, run into the back of somebody, or roll across a walkway and hit somebody. I mean, there's so many different things that can happen. So this is very dangerous. Morning headaches, wake up in the morning feeling, that your head is, full of cotton and just tense and tight. You can have insomnia. You can have difficulty staying asleep and have frequent wakening. Most people don't know that they are waking up frequently at night, but you feel it the next morning when you wake up and can't get your brain going. You've been waking up frequently, and maybe you do know. The other thing is it wakes you up enough that you get up and go frequently to the bathroom at night. So quite honestly, for men is a prostate issue, but second to that is just being awakened by these drops in oxygen enough not to know that you were not breathing, but to get you to get up and trigger going to the bathroom. So if you wake up frequently and go to the bathroom frequently, that might be what's going on. Lots of snoring and breathing through your mouth. You can wake up with a dry mouth, sore throat, can add to an already existing difficult problem. Memory issues. So if you find your memory just isn't as sharp, you're pushing thoughts through jello, you're having difficulty walking into rooms, remembering why you were there, just a foggy, cloudy brain, that is something that can do definitely not able to concentrate on factors, just so sleepy. You can sit in a lecture, you can sit at this podcast and just drop off and feel excessively sleepy. But it can also make you moody, irritable, depressed, so anxious, some mood issues there. So those are the symptoms, and this gentleman had reflected many of those. And again, we talked about the usual suspects. So testosterone, stressors, your adrenal issues, cortisol issues, vitamin deficiencies, many of those things. When I asked him and got a list of some of those symptoms, I was like, sir, you have sleep apnea. So we talked about, getting the test. So again, another big myth is having to go to, odd business or hotel room or something, all these wires attached and monitors and cameras watching you. And that's the way it used to be. We don't do that anymore. We also don't always have to use the big loud machinery and things like that. So things have changed. Please open your mind to this. So to continue with my gentleman patient. So after probably 2 years, every 3 to 6 months coming to me, doc, I'm tired. You probably have sleep apnea. We need to get a test. No, that's okay. 3 months later, doc, I'm tired. Same thing, broken record over and over. He did not want the sleep study. He did not want to look and see. So finally he came in and said, that's it. I'm so exhausted. I can't function. I'm about to get fired. And people do get fired from their jobs from this. So we got him tested and got him treated. He did have it, got him treated. Probably about a year passed. I hadn't heard anything from this man. I assumed maybe he changed insurances, moved on. People come and go sometimes. One night, it was about a Friday night, I think around midnight my time, and got this frantic call after hours. answering service said, "This gentleman is just beside himself, incredibly anxious. Would you please speak to him?" So we got on the phone. I was like, "Oh, hi. It's been such a long time." He said, "Dr. Pinkston, I am in a panic. I traveled and I'm giving a speech this weekend, and I left my sleep apnea apparatus at home, and I'm going to be exhausted, and I'm not going to be able to perform well with my speech." I find the thing that was so funny here that not only he was so resistant for such a long time, and finally did it, but the fact that he got such tremendous relief from it was kind of one of those "I told you so" moments, and got, which I'd never say, but he had gotten such, significant relief that I just found it extraordinary that, he's calling me on Friday night that he had forgotten it. I told him, I reassured him. I said, 2 or 3 nights without your apparatus is not going to cause you harm. You're going to be fine. Just rest as best you can. Get your speech done. Come home. Get back to your therapy. You're going to be just fine. And he was satisfied with that. So I just think it's funny how that can be such a metaphor to life. We are told over and over what we need and what we need to do, and those myths and misunderstandings keep us from getting good health. So let's talk a little bit about obstructive sleep apnea. So the problem is, what is sleep apnea and why is it important? Please forgive me, I'm a little ill this morning, and so I'm coming to you trying to keep hydrated, keep my nose clear. Please excuse me. So sleep apnea, if you imagine your mouth and, your nostrils that go to the back of your nose, go to the back of your throat, and then down into your lungs. When you breathe in, you're supposed to breathe in through your nostrils, and that humidifies the air correctly, brings oxygen down the back of the throat into the lungs. And you do this about 12 to 15 times a minute normally. If you're running, of course, and trying to get oxygen a little faster, then of course you're going to breathe faster than that. Or if you're in a deep sleep, you might breathe a little slower. So don't panic, your numbers are off. But 12 to 15 is about average. It is supposed to come in through the nose and out through the mouth to be humidified. But whenever you have obstructive sleep apnea, what happens is there is kind of a redundancy of or enlargement of the tissue that's at the back of the throat. So if you're obese, overweight, or if you just have a weakness of those muscles, then what happens is all of the tongue, the tissue, all of that, the back of the throat, then as you lay down, falls to the back of your throat and closes off your airway. And that's why when you breathe in, you make such loud, extraordinary noises and snoring, because you're trying to get past that obstruction. Whenever you have that much obstruction there and the loud snoring, then that's what cuts off the oxygen. But there's another way that it occurs where for some reason we call it central sleep apnea. And that is where the brain actually turns off the breathing. We don't know why this happens, but it just sends kind of a skip or a, pause signal and doesn't allow breathing to continue. So you hold your breath until your brain says, whoa, wait a minute, we need some oxygen. And then all of a sudden you'll take a breath and keep breathing from there. If this happens over and over and over and over again, as you relax, the muscles fall in the back of the throat, or if your brain tends to turn this off, or both can occur at the same time, well, then sleep apnea occurs. Those drops in oxygen levels, and then over time, drops in oxygen levels will begin to have some effects. Now, this is why I have my notes here today, just to make sure I give you some good information on the percentages. So get your mind wrapped around these issues. 84% of stroke patients have a history of sleep apnea. So, if you do more, if you have, it's not really that there's a certain amount per night that occurs or a level of severity. It's just its existence. And so you have a 3 times more likely ability to have an event if you have sleep apnea. Now, the problem with these issues is, it's mostly kind of a cosmetic in a way. The snoring, the heavy snoring, the holding of the breath, kind of what that does with your partner in the room. It also can destroy marriages. So I've seen people live and sleep in separate bedrooms for the majority of their marriage because of snoring. And that, you have to know, interferes with marriage and with intimacy and is significant. I think that it has the potential to add to divorce issues. So honestly, this is very important for your marriage. The stress on the heart. So the heart, I think, is the major organ that's affected. And again, most patients, other than the kind of cosmetic and marital issues and all the other issues that come with it, say, I feel fine, other than being a little fatigued or some of those other symptoms that I mentioned. I think I'm fine. I don't really want to test. And I don't really think they imagine that they'll just stop doing it at some point. But it won't. Once you do it, and it will not stop. And needs to be addressed early, because the longer that you wait, the more effects that this will have on you. So I tell my patients that sleep apnea can take 10 years off your life, 10 fantastic, great years off of your life. So address it now and address it early, because the damage starts early and accumulates over time and then can become irreversible. There is that period of time of 10 to 15 years where if we catch it, we can reverse the damage, save your marriage, and make you feel a heck of a lot better. And it doesn't have to be this thought that people get of laying in an office room with wires and these big machines. This is not how it works. So the other things that can happen. So with the cardiovascular system, are you one that goes to your doctor and are on 4 or 5 different medications for your blood pressure, and your doctor has told you that you have treatment-resistant hypertension? And so you can get these numbers that go into the 200s over 110s, and you're on 4 or 5 medications and nothing brings it down. That is sleep apnea underneath. The other thing, too, is when I have patients, and they can be thin and in great shape, you don't have to be obese for sleep apnea to occur. There's not a specific body type that this occurs in. Definitely with obesity, acid reflux, things like that, it is more likely. But there are people who have none of these issues and still have to suffer from sleep apnea. So don't pin yourself to a certain type. There may be people who don't really snore very much either, but they gasp and hold their breath at night. So your spouse most of the time will come in and tell me she is snoring too much, gasping for air, and you're like, I'm fine. I don't notice anything going on. But your spouse is like, this is scary, and I know that's got to have a deleterious effect over time, and they're right about that. So on the heart, though, I think that is the most important part that's affected. I'll have patients who are in great shape who come in and have been working on their weight and blood pressure and, cholesterol and diet and all these things. And their blood pressure stays about 140, 150 over 80 or 90, even maybe 100. And they can't figure out why. We put them on blood pressure medication and it just doesn't help. And I can have them on several and it just won't go below about that 135 over 85, 140 over 90 and above. And it just won't budge even with medication. That is almost always sleep apnea. Congestive heart failure. So if you are waiting over time and pumping against that higher amount of pressure in your system, then that builds the heart muscle like it would if you had a bicep and you were doing weights with a bicep. You're increasing your weight, you're going to grow that muscle. Well, that's great for the bicep. It is not good for the heart. You want your heart to stay the same size. Strong, yes, but stay the same size. And so congestive heart failure is where the heart will actually swell, and then you get a backup of fluid CHF is what it's also called, and that backup of fluid goes into your feet. So you get feet swelling, you can get abdominal swelling. You can also have difficulty laying flat at night. You feel like you're drowning. You have to sit up like you've got fluid in your lungs, or your doctor can hear fluid in your lungs and you just have trouble breathing, and your doctor can't hear you move air very well. Congestive heart failure. With that comes cardiac arrhythmias. One of the number one reasons of atrial fibrillation, or AFib, which is so pervasive now, we find this all the time, very dangerous because it increases your risk of stroke for one, but cardiac arrhythmias happen from from the obstructive sleep apnea and the effects on the heart, and then sudden death. So again, you don't hold your breath and die at night. Okay, that's not what causes the sudden death. But more than 50% of sudden deaths that occur are from underlying heart issues, which could be related to sleep apnea. So a big one there, they have a 30%, what they're reading, a 30% higher risk of heart attack or premature death. So that is really a big deal. You don't want to leave this world too early. Then cancer. Even cancer is associated. So metabolic problems, cancer can be an underlying cause. Poor sleep. So people report insomnia. They weren't aware that they're having poor sleep, but there are ways of looking at your sleep and making sure that you're getting deep sleep. You can wake up the next morning and go, I feel like I slept all night, but really you didn't. And again, there's some tools and ways of doing that. One of my favorite ones is Oura Ring. I've mentioned it here before. OuraRing.com. And I don't get any benefit from selling. I do not sell this, so I do not get any benefit from advertising. I just think it's a great product. So OuraRing.com. We mentioned mood disturbances, depression, anxiety, waking up anxious in the morning, feeling depressed during the day, shortened attention span, moodiness, irritation. Those are big ones. And those aren't necessarily depression, but can be misdiagnosed as just depression. Given medication, you want to get to the root cause of what's going on. The daytime sleepiness, I think this is by far the most important thing. So sitting at a computer, sitting in a lecture, sitting in bed reading a book, sitting at your desk working. The worst one is being at a traffic light. You can be on a plane and in the middle of talking to somebody, and just you see the head nod, the head bob and going up and down. The loud snoring, it affects your marriage, your relationships. Obesity. So a huge part of sleep apnea is caused by being overweight. But did you know that you can be overweight because you have underlying sleep apnea? So there's a lot of hormonal dysregulation. Sleep disturbances are one of the number one reasons for, gaining weight, and sleep disturbances are definitely occurring with obstructive sleep apnea. Acid reflux. So not only is that, an underlying potential cause of sleep apnea, but can be associated with it. So we pay attention. The two do go hand in hand. Sexual dysfunction, so loss of sex drive, even erectile dysfunction. Those are issues that can be caused by underlying sleep apnea. It affects the cardiovascular system. So therefore it affects the arteries of the genital organs as well, and can affect your ability to achieve a good sexual function. Getting up at night frequently and urinating, we talked about that one. And then chronic pain. There is a high percentage, the notes that I have say 80%. Don't think 80% is quite correct. I don't have a scientific basis for that, just clinical experience. But it seems like patients who have chronic pain have sleep apnea. And that, lack of oxygenation and fatigue and pain can be helped by just getting good oxygen and a good night's rest again. So if you have fibromyalgia and been diagnosed with that or chronic pain, you may have underlying sleep issues. Now, many of these patients are given opioids and narcotics to use for their pain, and that adds to the problem. So this is a nice little rundown of all the symptoms and diseases, but we have more to talk about because I did tell you that we have ways of testing and treating that go against all the myths that you have heard. And I definitely want you to hear about this. I'm going to take a very short break, but I want you to please visit my website, drpbetterlife.com. You can see the links to all of my shows, all the podcasts. We've been doing this for about 3 years. I'm very proud of this show. Got a lot of great topics out there, a lot of great guests. drpbetterlife.com. I want to thank DeNovo this morning and Magna Pharmaceuticals and Dr. Lesser for his help and support over the last couple of years. We'll learn a little bit about how to help ourselves with methylation and B12. I'm going to stop for a very short break, and we'll be right back.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is DeNovo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes DeNovo Plus B12 so successful? DeNovo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about DeNovo Plus B12 on The Better Life with Dr. Pinkston.
Hey, we are back. So thank you for joining in. And so we've been talking a little bit about sleep apnea, obstructive sleep apnea, or OSA, and all of the symptoms and all the problems that it causes. And so hopefully you're not just tuning in, but if you are, go back and listen to the last 20 minutes because I think it would be extremely valuable for you or somebody that you love. We're going to move into the testing and treatment. Again, I think the biggest myth that I get with patients is the thought of having to go and take off work and, take off from family and take the time to go in and be strapped down to these, machines and wires in a place where you're not comfortable and on and on and on. This is just not the case. The great news is most insurances now cover at-home testing. And with at-home testing, no longer do you have to wear the funny caps and bands around your chest and things like that. In some cases, there are some cases where there's still, some of these features, but very, very minimized and very easy to use. The instructions are easy. There's 24-hour service where you can call anybody at any time if you're having difficulty. They'll mail you a kit to your home. You get the kit. And one of the easier ones is a company called Virtuox. Virtuox, Virtuox. Again, I have no affiliation with them. I'm just a clinical practitioner, and they approached me and talked to me about this testing. We do order it. Most insurances will cover it. Now, if your insurance doesn't, we can do better diagnosis codes and prior authorizations and usually get it covered. If your doctor is a great advocate for your health, they will find a way to get it covered, even though sometimes, not always, insurances will be a bit resistant to the cost. They just need to understand this is absolutely needed. Once your doctor goes through that process to make them understand it's needed, you can get this testing done. So most of the time you can just fall asleep with a little clip. You've seen those oxygen saturation measurement tools that your doctor puts on your finger when you go or when you're in the hospital, and wear one of those. There's a lot of different types. That's one of the main ones. There are some companies who are using devices that are like Apple Watch or Samsung's or, some of those other watches. iPhone claims to be able to do some of this type of work. I caution you on that. It is a great screening tool. So the difference between a screening tool and a diagnostic tool is important. A screening tool will allow you to test the road, see if it's a possibility that you might have this diagnosis. A diagnostic test will tell you absolutely hands down, yes, I have it, no, I don't. So these watches and all that catch this irregular breathing, the Oura Ring is another one that I mentioned earlier. It'll catch irregularities and drops in oxygen saturation, but it will not diagnose it. So you cannot take these results to your doctor as a diagnostic test and then get treated based on it. But you can take these results to your physician or practitioner and tell them, I think I have it. Here's an indication of possibility. That might help with the insurance verification process. Might just also help your doctor understand you're concerned about this. And if I ever have a patient that comes in and asks me for a sleep test, that's it. I'm going to have to retire because I've reached the pinnacle of my career. Nobody's ever asked for it, which is unfortunate. So maybe now you will. You will go ask your physician. You're not as intimidated as you were previously. So the at-home test is usually one night. Sometimes it could be two, just to validate, make sure your testing was correct. You send the little contraption in a prepaid postage envelope or box, send it back to the company. They have their doctors who will evaluate the results. Send your doctor or send me results, and I will look them over, make an assessment as to the severity and what needs to be done next. And then this can take a few weeks, so you need to be patient. It's not something that's done quickly or overnight. But when we get the results, then I ask patients to come back for a visit to the office or telemedicine because I want to answer your questions. I want to talk to you about it. This is not something that we do just giving you a phone call. But normally we have companies who can test out any equipment or needs to see if your oxygen improves overnight, and these periods of not breathing will stop. So when you get the test back, what it does is it watches just for those frequent oxygen drops. I've seen some patients have 700 drops at night. That's insane. It's amazing. You should have one maybe. And so the oxygen drops are seen, and that diagnosis severity, mild, moderate, or severe. Now, the ways that it are treated are very, very different. And so there are a few who are a little bit older, and some of these things don't work. But it's definitely worth investigating. So if you have that obstruction at the back of your mouth and maybe your jaw is not set correctly, and that's the problem, your teeth are not set correctly, sometimes special mouth guards, not one from Academy, not one from Amazon, you have to get fitted by a dentist or a sleep specialist. But these mouth guards can hold the jaw forward a bit and bring that tissue off the back of the throat, and then allows for people to breathe more normally at night. There can be other apparatuses. There are sleep apnea and CPAPs or BiPAPs. These are machines that force air past that obstruction. So some of them you wear over your nose, some of them you wear over your mouth. But they are much, much, much smaller and easier to wear, not the giant tubing and the loud machine at the bedside. And some patients will absolutely sleep soundly, and their spouses too. In fact, it's quieter than the actual snoring. So most of the time it goes over beautifully, and you and your spouse and your significant other can resume sleeping in the same room, in the same bed. And so that can occur. There's also other ways. There are surgeries that can help to remove some of the redundant tissue. There are lasers. I used to run a med spa, and I had a Photona laser, which would reduce the tissue at the back of the throat, would help significantly. Those types of lasers in med spas and in some sleep centers still exist. Insurance generally doesn't cover those and the surgeries, but the surgery maybe, but not the med spa laser effect. But we were in the past beginning to see some changes in that. So don't be afraid to ask your insurance, ask your physician, make them go through that process and be an advocate for you. And so all in all, it's meant to just reduce the obstruction off the back of the throat. One of the best ways of doing it is weight loss. You guys know my story ad nauseum, that I lost 180 pounds. I was 300 pounds at one point, and I had sleep apnea, of course, being that overweight. I'm now 120, and my sleep apnea is gone. So it is curable by losing weight in most cases. So I definitely ask you to do that. So with all of that treatment, what happens, and it doesn't take long at all, once you have one good night of oxygen, you can wake up more clear-headed. Definitely don't fall asleep at the wheel anymore. The fatigue will lift. You don't have to drink as much caffeine. Your mood is better, your concentration's better, your marriage is better, everything around you in the world is just so much better. But to feel better, sometimes pain is lifted. There's just an extraordinary amount of things that come with it. You definitely sleep better. But I think you have to be patient and give it several weeks, several months, sometimes several years for all of that damage that has occurred. If you've ignored it for some time or put it aside, I won't say ignore it, but put it aside for some time as we do, that these issues will begin to resolve. So your stroke risk goes down, your heart attack risk goes down, stress on the heart goes down, congestive heart failure risk goes down. Your sleep is better, your risk of cancer is better. The depression, anxiety is better, your intimacy with your spouse is better. All of those things improve, and it is definitely well worth it. I think it's just worth it to feel better. I think it was Rosie O'Donnell who was in the news who finally got treatment. She was very resistant to it as well, and then she went on a campaign to let people know that it was life-changing for her. Life-changing is a huge statement. She said, I can't believe I let this go for so long, and that all this time, I could have felt so much better. She said, I absolutely implore people, get tested, get treated. It's not what you think, and it is absolutely life-saving, not only in years and quality and quantity of life, but the quality of life is, with a capital Q, is just huge. And that's what is important. I will tell you that the medical cost of this issue has been estimated to be around $4 billion. I feel like it's probably more than that because it is connected to so many diseases and so many problems. So I think the cost to our society and to insurances, which makes your insurance more and our taxes more, then I think it's an enormous cost, and really we should pay attention. So that's kind of the basics. I know people probably have more questions. Please visit your practitioner, ask for help. This is a very serious condition, both serious in a health conscious way, but in a social issue, marriage and cost and things like that too is very, very important. Please see your provider. All right. Well, I want you guys to have a fantastic week. Please go back, drpbetterlife.com. Please go back, and especially on your platform of choice, please subscribe. Also share. I want to get more information out to everyone. I don't collect emails. I don't charge for any information. This is free to you, and I want you to share this. So please, drpbetterlife.com, and we will have more next week coming up and more great guests in the future. We are growing. Things are going fantastic, and thank you to my sponsors. You guys have a great week. Thank you very much.
You've been enjoying The Better Life with Dr. Mary Ann Pinkston. For more information, go to drpthebetterlife.com. That's drpthebetterlife.com. And listen next week for The Better Life with Dr. Pinkston.